I've been doing this for 19 years, and one thing I have found is that health is beauty. So as a result, the aesthetic and functional piece within dentistry is very much interrelated. If a smile or a patient's teeth does not look right or look optimal, there's usually a functional component contributing to that behind it.
Welcome to HKB Uncut, the health, knowledge, and beauty podcast.
On this show, we unpack the newest techniques and trends in cosmetic surgery, how to tune out the social media noise to make empowered decisions about your appearance, and what you need to know before you book a procedure.
I'm Dr. Bill Kortesis.
And I'm Gaurav Bharti. We are board-certified plastic surgeons and co-founders of HKB Cosmetic Surgery, an award-winning practice with 11 locations across 6 states.
In other words, when it comes to aesthetics and cosmetic surgery, we've pretty much seen it all, and we want to share our knowledge and unique approach to aesthetics and beauty with you. Whether you're interested in cosmetic surgery for yourself or want to separate fact from fiction in the plastic surgery world, we hope you'll tune in each week.
Well, we are so excited today to have an incredibly talented dental surgeon with us who Bill and I have known for many, many years now. We actually trained together. The incredible Joe Chichetti. Is that right?
You're effing with me now.
Yeah.
He had that bullet in the chamber. He was ready. He was ready to do that.
So, Joe, let's talk about the first time we hung out.
No, let's get the pronunciation correct.
It's Joe Chichetti. Chichetti. Say it again. Do it.
Chichetti.
Joe Chichetti.
There we go. In the house.
Joe, you approve?
Yeah, you got it, man. You nailed it.
Joe, what was our first meetup at Wake Forest in Winston-Salem?
I think we met in the operating room once. Like I was coming in to take out some teeth before you did your thing, but then I think at one of the, it was either at one of the bars or possibly at our house.
Or when you were
yeah,
performing?
Yeah, exactly. I used to play shows at those places on 4th Street at Wake. So yeah.
Seems like yesterday, right?
Yeah, it does. It really does.
And we're full circle.
Yeah.
We're excited to have you on the show. You know,
Yeah.
the goal today is kind of talk about how kind of teeth play a part into the overall aesthetics of the face.
Yeah, absolutely.
And how
Absolutely.
everybody's like, oh, hold up, you guys are associated with a cosmetic dental practice, and how does that go in with aesthetic surgery? And actually, it goes in hand.
Yeah, it's pretty remarkable. Joe, explain to us, you've been doing functional dentistry for a long time.
Yes, sir.
And, when we talk to patients, sometimes we talk about this idea of we as plastic surgeons or aesthetic surgeons restore form and function.
Mm-hmm.
Talk to us about, what's the difference with aesthetic dental surgery or dental procedures and then functional? Like, explain kind of how you got to where the point you're at now.
I've been doing this for 19 years, and one thing I have found is that health is beauty. So as a result, the aesthetic and functional piece within dentistry is very much interrelated. If a smile or a patient's teeth does not look right or look optimal, there's usually a functional component contributing to that behind it. So we have found in treating the functional areas in conjunction with enhancing with the smile, we just get stellar results, and the prognosis, meaning the longevity of the results we're generating, is much longer.
Let's dive deeper into that. What do you mean by like functional? What functional things are you seeing that play a part into the aesthetics of how the teeth look?
There's two main pieces to that. One is actually the airway, a good, open, functional airway, because if a patient has a tight airway, they will compensate, okay? And the way they compensate is usually in their sleep, open mouth breathing posture while they're sleeping. They'll have incorrect myofunctional habits, incorrect swallows, which will move teeth. Our lips and tongues will move teeth a lot better than braces or aligners. So that's a big component. So every treatment plan, we take a CBCT so we can map the airway, so we can kind of develop it around that. And then moving downstream from that, then getting into the bite, making sure that's level. Because
So when you're working on airway, is it the dentition moving out in this dimension that helps with that, or is it AP? Which dimension?
So
are we
it's
talking
anterior,
about?
posterior.
Okay.
So the upper airway is a simple way to think about it is neck to the end of the teeth. So when we take a CBCT, we're looking behind the tongue primarily in relation to that space available for air to pass through. We want low upper airway resistance, little to no resistance for that air to go through. Patients with high upper airway resistance, those are your patients who snore, those are your patients who might have apnea, that sort of thing.
Is there any way you can see that externally without getting imaging or the testing that you're talking about? I mean, what are some of the characteristics? And signs?
Sure. So there's several signs we see. One of the biggest signs we see within the dentition is chronic grinding and dental wear, premature teeth wear. So how you might see that externally, say if you're in a room with a group of people, is tooth display in relation to the age. So for example, with in a 20-year-old patient, I would expect to see a lot of tooth while they're speaking, the lip at rest, versus an older patient, just with time they'll have wear. But if that 20-year-old is not showing any teeth, there's either a positional or wear issue or both contributing to that. And sometimes it can be parafunctional habits as a result of the collapsed airway. So back to your original question, functionally speaking, we want to open the airway, and then we want to make sure the bite is level and atraumatic. We chew in a circle, and if anything is unlevel and things aren't guiding in such a way, teeth will rub and wear unevenly, and that can have major functional consequences, but also aesthetic consequences as well.
It's a remarkable thing how incredible our bodies are, and I'm talking specifically about the way that our dentition is and how we maintain and achieve occlusion, which is when your teeth are together.
Right.
I mean, you can tell when it's off by like just a little teeniest like micromillimeter.
Oh yeah.
And I think that just
And
blows my mind.
it drives you crazy.
It drives you crazy. I'm like Joe, I still can feel this. But it's amazing how that can happen.
Like if you had a piece of food stuck in there, like you could just tell it just drives you bonkers.
And patients are very attuned, and doctors are very attuned as well. But those small details are the difference between a fantastic outcome and a not so fantastic outcome. So it's interesting, this methodology we leverage. I'm a cosmetic dentist, but yes, giving you outstanding cosmetics, going through this pathway, we can also help many functional problems.
How do you talk to patients about that? Because again, to your point, patients come in, they're like, "Hey, doc, I just want them to look good."
Right.
That's my main goal. I need them to look good. I want them to look great. I don't want them to look fake. Mm-hmm. How do we make that happen? And how do you discuss the functional piece?
So we talk about why it doesn't look good. Mm-hmm. Okay. So a patient can come in and say, I want an aesthetic solution, and quite frankly, I could put veneers here or there and it would look better. But let's talk about why it doesn't look right. Okay, this is why your teeth don't look right. What caused that? Let's fix that. Mm-hmm. And then that'll render even better aesthetics. So that's how we do that. We make sure we understand
more
the patient. Yeah. We understand let's understand the patient's chief complaint, and let's find the etiology behind it and solve that, and then let the cosmetic dentistry fall into place.
Can you walk us through what a new patient interaction looks like? You have an HKB patient that comes in for evaluation. They're like, "Hey, doc, I want better looking teeth. I'm not happy with how things look." What does that evaluation look like for them?
So when a patient comes into our practice, they're greeted by our new patient coordinator, Greta. She's a rock star, and she really tries to understand what those patients' needs are, that patient's why. That's the term we use a lot in our practice. They then, once we have a good understanding of that, we walk them through our evaluation process. It takes about an hour. And during that time, we take a 3D CBCT that helps us map the airway, but also looks at each individual tooth. We take a photo series. We also take just a few standard dental x-rays it still helps me really get a good idea of the bone levels, the periodontium around the teeth. And then we take an optical scan, which is a digital impression. It's a special camera. It takes 50,000 photos a second and generates a three-dimensional image. From there, we're then able to look at everything really holistically in relation to the patient's chief complaint, talk about how we can fix that. Talk about what's causing that, number one, and then how we can fix that in our process for doing that. And depending on the situation, there's several different ways we might execute that for a patient.
And how does that work from a treatment standpoint? Like, are patients coming in and getting temporary solution and then a permanent solution,
Sure.
or is it a multi-day process, or is it over multi-months?
So let's paint that into a couple of scenarios. So one great thing about the way we do things is we have our own full dental lab. So how that would play into a situation you were talking about, if a patient's pursuing cosmetic dentistry after that initial, here's a great scenario. I had one just the other day. Patient's why was her daughter's getting married and she wants to look good for the wedding. Okay, so we need to make sure these pictures look outstanding. Her main etiology was tooth wear, dental wear. She was ground her teeth down, and so her teeth were shorter. As a result, when she was talking or in conversation, she doesn't show a lot of tooth. That will age a patient big time. So I often tell patients, we get your teeth to the proper contour, I can give you 10 years back. So how that plays out after new patient consult, I have all the records so I can design the teeth in CAD/CAM software. I work with a top tier designer. Him and I work hand in hand. His name's Weston Hatcher. He's a rock star. So then the patient comes in for a preparation appointment. We get the teeth ready. We then mill a prototype form, which is different from a standard dental temporary for anyone who has experience with this sort of thing. And what's different about that is we actually design the smile on our software and then mill out the final design in a type of material that we can easily adjust as needed. But it looks great and it feels great. So the patient gets a true test drive, and then we're also really able to test shade and that sort of thing. We can do this relatively quickly. So the patient, if they came in for a prep appointment and we're only treating 10 teeth, we're probably placing the prototype that day. If we're changing the bite, the vertical dimension, that might be 28 teeth. I usually have them come back in a few days. We'll put them in a provisional just for a day or two. Then we seat that prototype. And then, quite frankly, then we're kind of cruising because they can test their new bite, they can test their new look out, we can adjust shade. They'll typically then come back the following week. We decide if we're happy with everything, and then I'm fabricating things. So for a 10-tooth case, that can be as short as 3-4 days, depending on our approval. It can be a little bit longer, but we have total control. I mean, I can go as fast or as long as a patient wants. I make sure I have all the parameters I need, and I have measurables digitally to make sure we're there. Then we just really want to make sure the patient's happy with everything.
I got a couple turbo questions for you. Quick answers, okay?
All right.
How do you make it look like people haven't had their teeth done? Like, I see some people with their teeth done, and man, they look like, they're just like,
Yep.
I mean, tell me, what do you do?
So there's two things that go into that. One, there's shape, and shape is directed to the face, okay? When we design teeth, we want to design teeth that fit the face. So when this is done, the photos are up. The optical scan I talked about, which is a three-dimensional photo image, will stitch to the two-dimensional image. So we can adjust teeth within the face and get it to where it favors that face. That's one. So the teeth have to have the right shape. That dentistry that doesn't look real, it usually is a very standard shape. Everyone can tell what's happened. Number two is actually material and translucency. Okay, so in our lab upstairs, when we're designing these restorations, we are adding characterizations to make the restorations reflect light like natural teeth. Certain pieces of our teeth reflect light differently. There's more translucency in the incisal edges versus the cervical. You want, depending on how much lip the patient's showing, I might add higher value in certain areas so it'll pop more or less. And so that's where that comes in. So the actual restoration itself in regards to shape and translucency, because our natural teeth, light reflects back differently on different pieces of that tooth.
How often do you brush your teeth?
Twice a day.
Twice a day?
Twice a day.
That's it?
Yeah.
How about if we're going to do a pan-facial rejuvenation? So this is someone who's going to get pan-facial restoration.
Okay.
Dentition's part of it. What's the sequence?
What do you mean when you say pan-facial?
So pan-facial, when someone is going to get, periorbital rejuvenation, which means around the eyes, can get, hair restoration, can get ear restoration, can get rhinoplasty, can get facelift. I'm not saying they have to get all of them, but there's different needs that people have in their face, and the dentition are part of that.
Mm-hmm.
If people are going to have surgical interventions outside of dental work, is there a sequence that needs to happen? What's the favorable way to approach this?
So the favorite way to approach it would be to evaluate tooth display. As you're going through a pan facial rejuvenation, this patient's trying to look younger. Okay, so are they showing enough tooth in relation to their age? Say it's a 50-year-old patient, and when their lip is at rest or as they're speaking, you're seeing about a lip at rest, you're seeing a millimeter and a half. When speaking, you're seeing good tooth display. Then it might make more sense to go the surgical side first. If they're not showing any tooth, and I mean, it looks like they don't have teeth, that's a situation where it would make more sense to take care of the dentistry first, because I might have to change the jawline to establish, to get the teeth where we want it, rebuild the bite. That could potentially affect your results if that happened on the back
I think
end.
it's one of the advantages we have here, right?
Yeah.
Being housed in our mega center that we have here, and knowing our camaraderie, we can have a patient see both of us, and we can come up with a game plan together to dictate exactly what the best course of action is.
And it could be done simultaneously.
Right, right. It's so good for the patient, because they might be seeing you guys. You have a dental question. You ping me. I come downstairs, and vice versa.
Which we've already done multiple times.
Oh yeah, yeah. And it's the results are amazing when done in collaboration. The interdisciplinary care in this area is fantastic.
I was in clinic the other day and saw a patient of mine who I've done a fair amount of facial restoration stuff on, and he recently is having his total dental restoration happening, and totally defying aging. It is insane. Bill, this guy looks like 30.
People don't realize how the teeth age you.
Yeah.
I mean, I've since you've been here, I've noticed people's teeth more and more. I'm like, man, you need to get those fixed. You need to get those fixed.
Yeah.
It's a
Am I
big
showing
sign of
dentition or not?
You're
Okay, thank God. I want to make sure I'm showing.
So that patient, wonderful patient, that was one of the issues that weren't showing a lot of teeth at rest or while speaking. Look under the hood, and sure enough, we've worn things down.
Yeah.
And he's had
A lot of reflux, right?
Protected guidance, yeah, and there was reflux issues as well. So
Does a prior history of having a chin implant affect what you do, or a malar implant?
Not really. Okay. No, it doesn't. I can't think of a scenario where it would, because depending on the patient's age, usually if a patient needs a chin implant, they're usually a skeletal class 2 situation, and if I was to reconstruct someone in a class 2 position, depending on the severity, there's very predictable ways to do that and also protect the airway as well. So that's that. Not to get too much of the minutia, but a skeletal class 2 patient is more susceptible to an airway problem than a skeletal class 1 or 3. So whenever we're working with vertical dimensions, and those patients are really careful about that. So if I meet a patient who's had a chin implant and everything looks good from a facial standpoint, I can work around that very, very easily in relation to protecting the airway, and that usually means some sort of vertical dimension increase. So,
what is your favorite rock band?
Metallica.
How many times have you seen Metallica?
I've seen them going on, I think, 15 times. I'm seeing them at the Sphere this fall too.
Oh, that's gonna be great.
I got tickets to that. The Sphere is awesome. Be great.
I need to go see them.
Yeah, I highly recommend it.
And what is it? Are you guys your band touring now?
we're not on tour right now. We're recording at the moment, so we'll probably have a single out in the next couple weeks.
What's your role in the band?
I'm the guitarist, and then I also mix and master everything.
And then what about jumping around in regards to the severity or level of restorative things that you'll do? What's the most simple thing that you'll do for a patient and the most complex thing that you'll do for a patient?
I mean, we meet patients right here at HKB all the time for whitening solutions. A big part of our protocol is also aligners. We do a lot of orthodontics, which is relatively simple for patients. We'll do composite bonding where indicated, but then we'll do all the way up to a full restoration. We do a lot of dental implants or a full mouth rehabilitation where we might be rebuilding the bite by crowning every tooth. Those are some of the most dramatic changes we'll see, some of the most fulfilling, and those patients are definitely super happy after something like that. But no, we can go from simple to very, very complex if needed.
Well, we're so thrilled to have you here to help provide that continuum of care to our patients, because the facial aesthetic, the harmony that appropriate dentition. Oh yeah, the harmony that dentition brings to it is critical. Which is
I think it'd be kind of cool the next time we do this to show a couple cases. Yeah. I think it'd be kind of really cool to kind of walk through the whole process of somebody getting aesthetic surgery to kind of dental restoration and what that looks like.
I think it'd be really valuable for anyone watching this to understand what we're talking about with tooth display, because that's definitely something you can't unsee. And I've met patients seeking out, facial work and been, I don't want to say, maybe disappointed in the results because they're not getting that bam moment with their smile. And, I often joke, I have a great case that we're finishing Friday. Actually, we should show that one because that's the dental, that one's a dental facelift for sure.
That's awesome.
So we've changed her vertical dimension, and in doing so, she looks so much more youthful, really defines the jawline, and she's displaying the appropriate amount of teeth. That would be a real good one to show.
Well, Joe, you're top of the game.
Can you say his last name again? I want to make sure we got it right.
Chichetti.
Yeah.
Chichetti. Can you say it?
Perfect. You just did.
Yeah.
Awesome. Well, this has been an incredible discussion we've had here. Drop us a line or any questions or concerns or any thoughts for Dr. Chichetti.
Appreciate having you on.
Yeah. Thanks for having me. This has been a blast. Awesome.
Thank you for listening to HKB Uncut. If you enjoyed this episode, please subscribe to us on Apple, Spotify, or YouTube.
To book a surgery consultation or med spa appointment with our team, visit our website at hkbsurgery.com or head to the links in our show notes.